Recording in progress.
Hi, Jerry.
Hey, Jerry.
Hi.
So welcome everyone to the Town of Reading Board of Health meeting. So we'll start the meeting with a roll call. I'll start. I'm Rick Lopez, Chair of the Board. Paula,
Present.
Kevin,
Yep.
Joan.
Yes.
Okay, very good. In terms of the agenda tonight, we're reviewing the minutes from the short meeting we had on March 26th, as well as our regular meeting on April 11th. We'll have public comment if there are any members of the public. And then we'll go on to a variance discussion from Professor's Market, a camp permit discussion, which we've had the last couple of years from the YMCA. Erica will be doing a follow-up on the opioid funds. And there's Carrie. Hi, Carrie.
Hey, Carrie.
Hi, guys. Sorry to be late.
Okay. And Carrie actually had suggested that Albert Pless from the Office of Equity and Social Justice come and talk to the board about his area and particularly as it relates to our three goals in our CHIP. And then a day will wrap it up with our usual monthly report and so forth. So in terms of minutes from April 26th, they look pretty good to me. Any comments, suggestions, edits? Yes.
Just one little one.
Yep.
On paragraph 2 under food code.
Oh, no, we're doing the March 26th.
Oh, sorry.
Yep, that's okay.
That was fine by me.
Okay. Okay with everybody else?
Yep.
So I'll make a
Yes.
motion to approve the minutes from March 26th. Do I have a second?
Second.
Paula, roll call. Carrie,
Yes.
Paula,
Yes.
Kevin,
Yes.
Joan.
Yes.
Great, thank you. And then for our last regularly scheduled meeting on April 11th, Paula, you had a
Yeah. Paragraph 2, line 6. I think it should say cook chill, not cook shill. It starts with Jennifer Velasquez.
Cook chill.
Yeah. It says it twice, but the second time,
Yes.
next to the bottom of the page. Yeah, that's it, right there.
Cook,
Okay.
chill.
Right.
Yeah.
Thank you.
Yeah.
And otherwise, it looked fine to me.
Yeah.
Right.
Good catch, Paula.
It's because I'm a slow reader.
And I had one actual suggestion on that same segment around the food code. For someone who wasn't at the meeting and reading this, they may wonder what the outcome of that discussion was. And so I would add a sentence at the end of the adoption of 2022 food code to say, you know, that the board agreed that we would plan a public hearing on this change.
Good
to
point.
the food
Good
code.
point.
Yes.
Just
Really
so
good point.
you know that. With those edits, I'll make a motion to approve the minutes from April 11th. I have a second.
Second.
Second, Kevin. Roll call, Carrie,
Yes.
Paula,
Yes.
Kevin,
Yes.
and Joe.
Yes.
Thank you. Great. I don't see any members of the public here, so we'll move on from that agenda item. And I'll turn it over to Aday for the Professor's Market discussion. Introduction.
All right. Thank you very much, Dr. Lopez.
So I'll just go ahead and give a brief introduction and then hand it over to Tiffany from Burger Food Consulting. So this is about requesting a variance for Professor's Market. The food code states that a establishment shall obtain a variance from the Board of Health before packaging time temperature control for safety food using a reduced oxygen packaging method. The food code also states that a food establishment that packages time temperature control for safety food using a reduced oxygen packaging method shall implement a HACCP plan, which is the Hazard Analysis and Critical Control Point Plan. Professor's Market is here tonight, Mr. Frank Pellegrini and Mrs. Tiffany Todd. They're here to request to conduct the specialized processing method, which is called the reduced oxygen packaging, in order to impede the growth of microorganisms that can spoil their food products, which will in turn increase the shelf life of their food products. Now, I know people are wondering what exactly reduced oxygen packaging means. It is essentially the reduction of the amount of oxygen in a package by removing the oxygen, displacing the oxygen, and replacing it with another gas or combination of gases, or otherwise controlling the oxygen content to a level below the level normally found in the atmosphere. It is also a process that involves a food for which the hazards, Clostridium botulinum or Listeria monocytogenes, require control in the final packaged form. Can you put up the red slide, please? All right. So there are 5 different types of reduced oxygen packaging methods. We have the modified atmosphere packaging, we have the vacuum packaging, we have the controlled atmosphere packaging, we have the cook chill packaging, and we have the sous vide packaging. Professor's Market is here tonight requesting to conduct vacuum packaging, in which air is removed from a package of food and the package is hermetically sealed so that a vacuum remains inside the package, thereby impeding the ability of microorganisms to grow and spoil the food. I will now hand it over to Tiffany from Burger Food Consulting to give a quick presentation about the variance request, the methods involved, and what Professor's Market is trying to achieve.
Well, you pretty much summed it up. Professor's Market wants to take some marinated different proteins, marinate them, and then vacuum package them, and then sell them for retail sale in their establishment. They will follow the HACCP plan, following the critical control points of temperature control and of the labeling to make sure that we don't have any issues there, and that all employees are aware of the temperature requirements of remaining below 41 degrees and the time parameters that we are allowed to hold that meat at 41 and below.
And they also submitted a HACCP plan to us. So if you want to quickly go through it, just briefly.
Through the HACCP plan? Sure. So the HACCP plan, that's the hazard analysis critical control point. So we identify the hazards that we're worried about. Most of our pathogens like Salmonella and E. coli, they'll be dealt with because they're kind of competing organisms. So the 2 big ones that you've already mentioned are Clostridium botulinum and Listeria. And those we are going to control through monitoring the temperature. They will keep a written log of the refrigerator and freezer temperatures that they'll check twice a day. They'll maintain their records for 30 days. They'll maintain their records for 6 months. Frank Pellegrini is the trained designated person, so all vacuum packaging will be done under his supervision. Standard food safety practices of there's no bare hand contact allowed, all of their sanitizers and areas need to be cleaned and sanitized. They need to have everything up to date there. Let's see, we also talk about how things move in their establishment in the HACCP plan. They receive the food, TCS food is immediately put into proper storage. They also have to, because Clostridium botulinum can be found in the air and it can come in on products, they need to be very careful about keeping the area clean and keeping their vacuum packaging bags in a sealed container so that they stay clean. There's no chance of contamination there. And labeling is really important in the HACCP plan as well. All products have to be labeled with the following: what the product is, that it must be refrigerated at 41 degrees or lower, the date that it was vacuum packaged, and then the statement not used by, not to exceed 30 days from date packaged, and packaged by, which would identify, oh, there it is, which would identify the employee who packaged it. If items are frozen, then we also have to have an additional statement that says that it must remain frozen and to be used within 4 days of thawing. And then post-packaging is when we're worried about it. Clostridium botulinum can grow without oxygen, which is exactly what we're doing. We're removing the oxygen from that package. And that's why we want to make sure that we stay at 41 or below to limit the possibility of that growth. Just scrolling through, I have the flow chart that shows they receive the packaging, they store it, they receive their raw poultry. So the I'm on page 6, has the flow chart, I think. Oh no, maybe it's,
There you go.
yeah, yes.
6,
So that's,
yeah.
yep, that shows how everything comes in, how it's stored, and then the 2 critical control points of labeling and then storing at appropriate temperatures. Then further down, we have some training information, and then all of their ServSafe certificates, allergen certificates, and then on page 20 is their log that they will maintain whenever product is vacuum packaged. These are the records that they will keep for 6 months, along with the refrigerator freezer log. Yeah, yes.
Right.
Yeah, those are the recipes, and then there's all the specs for the vacuum packaging machine. Are there any questions I can answer?
Go ahead, Karen.
Sorry, just trying to get to my, got multiple windows here. Yes, thank you. I know that there's one person who's trained on that. Is that typical in what you see, Tiffany, for folks? And is there accommodation for if somebody was out on vacation or anything like that? How would that impact?
It is typical. Usually it's the chef or the sous chef that's the only one. In larger establishments, they may have more people. It's certainly, I think it's a document that could be updated if Frank wants to add in additional employees later on down the road.
Yeah.
But I know a lot of people like to have control of it. And the less people, he can supervise others doing it. Got it.
Yes, thanks. Yeah, and I know it's a lot of work. So I commend Professor Market for taking this on and recognize that the skill and effort that goes into it. This is a extra level.
Thank you. Any other questions? I have a couple. One is, Tiffany, the plan looks extremely complete and detailed. Is this process and the plan to do it correctly, is this comparable to sort of industry standards? I mean, we've all purchased vacuum packed, meats or products before, so it's done on large scale in industry, in the food industry. Is this plan comparable to the kinds of standard FDA standards that those health industries are held to?
At retail, yes. It really doesn't matter if do vacuum packaging once a month or they do it every day, these are the steps that they have to follow. These are the parameters that they have to work within.
Okay. And I would ask Aday, does Professor's Market having this process, does that change in any way the frequency of inspections that from the health department that you would do, or does it change the risk factors and increase the frequency or not?
Not necessarily, but you know, we just have to wait and see. So essentially, they had their product for like, I think 4 to 7 days. But now, if this is approved, they'll be able to have a shelf life of almost 30 days, you know, so they don't have to keep making it like every week or so. Again, we're just going to have to wait and see if they're following the HACCP plan, if they're following the food code and everything. But for now, I'll give them the benefit of the doubt and and just go from there. I have reviewed the HACCP plan myself, and it looks adequate. And I recommend that the board approve this variance request.
Any other comments, questions? Okay. So I'll make a motion to approve the Professor's Market variance request for reduced oxygen packaging.
I second that.
Thank you, Paula. Roll call, Carrie,
Yes.
Paula,
Yes.
Kevin,
Yes.
Joan,
Yes.
and Rick, yes. Great. Well, thank you, Tiffany.
I believe Mr. Pellegrini would like to speak.
Okay.
You're on mute. Mr. Pellegrini, can you unmute yourself? Cassidy, can you unmute him? No.
No, I asked him to unmute.
He says he did. Oh,
Frank, try holding the space bar down.
Hmm.
well, maybe there's a technical issue. No.
Check volume. That's the other trick that gets sometimes if the computer volume is down or muted on the keyboard. Erica had that same experience. I can tell. I saw her grin at me. Or maybe not.
Mr. Pellegrini, the mute button is in the lower left-hand corner, looks like a microphone. Is that what you've clicked? No. Well, I think we'll probably need to move on. But I appreciate your presence here and Tiffany, your explanation of the process. And I'm glad we were able to accommodate the request. Thank you. Bye-bye.
Thank you.
Okay. You too, Mr. Pellegrini. So next, Aday, are you going to handle the YMCA request?
Yes, but is there anybody in the waiting room for YMCA? Okay, I guess
No,
Mary
Okay,
Ann Hannaford?
so-
No.
it's not important for them to be here, I guess. So we'll wait for them to show up at the next meeting to ask for this.
So we'll defer this to the next meeting.
Correct.
Okay.
Was somebody supposed to show up a day?
Absolutely. Yes. Somebody
Okay.
will show up. So
The only, the only thing about this, and we could certainly defer them to June, is that, do they need to have a permit in order to begin to enroll campers into their camp? And would delaying it to June, or whenever that is?
well, honestly, I feel if it's important to them, they will be here.
Yes,
So I think this has come up in the past where
right.
it was customary to send the letter, not to show up necessarily. I don't remember the why being in the room too many years in regards to their camps. And I remember specifically, I think we ran into the same thing last year, and it was just it's not their, it hadn't been the customary way that they needed to go about it. They sent the letter in the request, and then the board either was yay or nay. Them being here would be more from a effect if we were going to deny it. You know, they'd want to be here, obviously, but they probably feel pretty confident that we're not going to, which I'm assuming we're not going to.
Yeah, I sort of agree with you, Kevin. I think I wouldn't mind deferring it, but I don't want to impede their enrollment a whole month, and which could be very problematic. I vaguely remember that was potentially an issue. And as I understand it, Ade, the letter that you included in the pre-board information, the letter from last year to them, they met all 6 of the requirements. And to your understanding, do they still meet all 6 requirements?
I mean, I can give a quick presentation on their behalf, and the board can go ahead and make a decision based on my presentation. But again, if this was important to them, somebody will be here tonight, 1. And 2, I'm not comfortable, pretty much issuing a permit prior to inspection to a place that, that provides services to kids. So I'm not comfortable with that, but I can advocate for them, and the board can make a determination tonight. And then I'll just let them know that if this happens again, we won't tolerate it. If you don't show up, it means it's not important to you. How does the board feel about that?
Terry?
I understand what you're saying, Ade, and I do support that, that this is a thing. I think that we're challenged because past practice has been different, and this is a relationship thing too as well. So I think that's the challenge of this. But I would tend to agree that issuing a permit before inspection is a little problematic. So I understand why you're expressing this. I hope we can work this out and figure out how to make sure that the Y is a active participant going forward. I mean, it does put the town in a difficult position, issuing a permit prior to inspection. We can rescind it, but it's just complicated. So.
All right, so I'll just go ahead and advocate for them, and the board can make a decision. So YMCA is requesting permission from the Board of Health to operate a recreational camp without prior inspection. The YMCA serves students that use vouchers as a means of payment, and the state will not allow the YMCA to register these students until a recreational camp permit has been issued by the Board of Health. 105 CMR 430, which is the minimum standards for recreational camps for children, makes provision for local boards of health to grant a license without prior inspection based on the following conditions. 1, the camp is under the same ownership and directorship as the prior camping season. 2, the camp has had a satisfactory inspection report the prior camping season. 3, the Board of Health determines, based upon the record of the camp, there is no evident risk to the health and safety of campers. And 4, the camp is subsequently inspected by the Board of Health during the camping season. So based on those, those criteria, the YMCA meets all the requirements. I would recommend that the board grant a license without prior inspection to YMCA, with the understanding that the camp will be subsequently inspected during the 2024 season, and also with the understanding that they would have to show up at the next Board of Health meeting in 2025.
I
So,
think that's reasonable.
yeah, you had included on last year's letter 2 other conditions which weren't up on the screen. One was that the camp submitted a timely application for renewal of its license. And secondly, that the recreational camp is located in the same site. Are those, Ade, would you apply those 2 criteria as well?
Correct. Yes. So those are valid. They're still in the same location, and they have turned in their application.
They have, okay. Go ahead, Carrie. You're on mute. You're on mute, Carrie.
Sorry, of course I am. Ade, who will be doing the inspection?
All right. So as you all know, our health inspector is leaving, but I am in talks with Annette, who is our shared services coordinator, to see if we can get the shared services nurse and the inspector help us out. If not, I'll do it.
Okay.
Thank you.
Just so it's fresh in our head, a day, can we invite the director here for our June meeting anyway? Because we did this last year, right? Now fast forward a year, and I'm a little fuzzy on exactly the reasoning why. Rick, what you had said earlier, I think you're correct. There's a timing issue of it all, and there's definitely an issue of how it used to be done. So let's just kind of get it out right while it's fresh in our head. And so just invite them up for the next meeting, put them on for a 10-minute discussion, just so we can all get on the same page for what 2025 is going to look like and why it needs to look like that.
Yep.
That would be my suggestion.
I agree.
Okay, so I would make a motion that we grant the permit, but make it dependent on 3 conditions. One is that in Ade's judgment, the camp meets all 6, or at least all 6 requirements that were listed on the letter from last year. That secondly, that Mary Ann Hannafin come to our meeting in June to explain why this is required this way before an inspection, and to clarify, and third, to sort of secure an agreement from the YMCA that they will appear in 2025 in a timely manner to if this request is made again. So there would be 3 requirements, but presuming that those are met, or particularly the 6 requirements you had on your letter for May 11th, 2023, that you can go ahead and approve the permit. So we're approving it dependent on those 6 items being met. And
Before anybody seconds it, Rick, can I interrupt you real quickly?
you may.
I wouldn't make all 3 of those together, because if they can't come to the June meeting, that will negate their permit. So I'd do the permit and then do the other 2 things, just to be.
Okay, so let's
Cautious.
the other two things for the June meeting, let's just go with the 6 requirements. If they meet the 6 requirements from a day's May 11th, 2023 letter to them, then he can go ahead and approve the permit. And Kevin, you're seconding that?
Second,
Okay, roll call. Kevin,
yes.
Paula,
Yes.
Carrie,
Yes,
Joan,
Yes.
and Rick, yes. All right. That's a plan, as they say.
All right.
Erica, thank you for being so patient. And, you know, we had a brief discussion at our last meeting because one of the 3, as you know, one of the 3 goals for our community health improvement plan is to address substance abuse and mental health issues. And it came up in that discussion about the opioid abatement funds, and Reading being actually the only town that's actually done anything with them in our shared services collaborative. And so I think we wanted to kind of hear where the coalition is coming from, what they're doing, what we can expect. It would be interesting to hear that. We've been wanting to have you anyway to give us an update for the longest time. So thank you for coming.
Wonderful. Thank you, Dr. Lopez. I appreciate the invitation, and hello to all the board members. To those of you I know, it's nice to see you again. For those I don't know, my name's Erica McNamara. I'm the director of the Reading Coalition for Prevention and Support. We're located at the Reading Police Department. Tonight, I'm going to go over very briefly just a snapshot of who the coalition is, what our history is, so you have a sense of kind of why we are doing what we do. The actual allowable use of the funds as defined by the state and the settlements, and our future plans moving forward. So a little bit about the coalition. Do we have the slides being shared, Ade?
Yes.
Okay, great. So a little bit about the coalition. We started in 2006 by local community leaders, families, our police chief, town manager, superintendent at the time, many young people, in response to opioid overdoses that were happening in the early to mid 2000s. And the decision was made to form a community-based coalition that would focus on primarily prevention with the opportunity to maybe expand services over time to intervention and treatment. So over the last 16 years that I've been in the position, we really have built an enormous amount of capacity and grown our services and our program. For the first 10 years of the coalition, we were funded by a federal grant, as well as some state attorney general funds that were also part of a settlement. We raised, we can just stay on the about our CPS slide if you would, thank you. In our grant work, we raised 1.2 million in federal grants, and then an additional 750,000 in other grants. We expended all of those funds to support our local community in reducing substance misuse, improving collaboration, and promoting mental health. So we do have long-term experience with funding, managing the requirements of state and federal details, which can be very persnickety, and we really have the expertise. So our current funding model, which is on the next slide, for the last, I guess, eight or so years has been focused on being under the town structure. So when our federal grant ended, we were given 10 years of the grant with the expectation that the town, because they had made an investment in our work, would ultimately pick us up as a in-house program. And with the support of the police department taking us on, we were able to do that with the town support. We also received additional funding from the town meeting group to hire our public safety clinician. And then for the past 2 years, we've received a small amount of additional funding from the opioid settlement funds. We do our work based on a variety of needs assessments. So we never do anything just because we feel like it. It's very much guided by prevention practice. We participate in a regional needs assessment, which is funded by our community regional coalition, which is Mystic Valley Public Health Coalition. That's Medford, Malden, Melrose, Wakefield, Reading, Stoneham, Winchester. And together we work on these specific issues of substance misuse priorities. And we conduct a full-scale needs assessment every 2 to 3 years We just recently finished ours last year. This includes key informant interviews, discussions with people directly impacted by substance misuse and recovery. We talk with young people. We conduct large-scale surveys, qualitative and quantitative data. We conducted youth needs assessment every 2 years in grades 6 through 12 with the Reading Public Schools and the Middlesex League. That's our youth risk behavior survey. We do conduct an annual review of death certificates. We look for all of the information related to how a person lost their life, whether they died due to substance misuse or by suicide. And that information is incorporated into understanding the context of these cases. We collect key informant data, post evaluations, and other key points of information throughout the work that we do. We track all our activities and client interactions in a cloud-based software that's HIPAA compliant called Social Solutions. And we track all our mental health and substance use calls for service and follow-up. So we have a lot of information that gives us details on what trends are happening, where are the priorities, where are the sticking points for some of these key issues, where are the areas of the behavioral healthcare system where we're falling down, where are people finding gaps in services, and so on. We can go to the next slide. This is just our staff. There's 3 of us, myself, the director. We have Tanya Jaranecki, who is our public safety clinician. She is dually licensed in Massachusetts as a licensed mental health counselor and a licensed alcohol and drug counselor. So she provides both of those therapies and can work with dually diagnosed clients. Jess Cruz is our outreach coordinator. We have a therapeutic space in our office, and that's where Tanya sees most of her clients. We're located in the police station, but she also sees clients privately in library space, as well as at the schools all across the district. Next slide, please. So just a little bit about the funds overview over the last couple years. When we were initially, this all started about 4 years ago. We knew the settlements were happening. We knew the lawsuits were happening. We met early with the town manager at the time and discussed what things might look like. There was a lot of loosey-goosey numbers in terms of what it might look like, when it might happen. It definitely took a lot longer than we had anticipated, but we just got the first deposits in 2022, 2023. And when we got the first deposits, we really weren't sure, even though there were expected dates of deposit for future funds, we really weren't sure if those deposits were going to happen. So in the first year, we drew down $23,000 under the town manager's discretion with the approval of town manager, with the approval of the town manager and town meeting, to use it for specific things that are allowed under the opioid settlement. This current year, we did the same thing because, again, we were expecting additional funds, but weren't quite sure what was going to actually happen. A couple things we've learned since then. Settlement deposits are expected from a number of the settlements: Johnson & Johnson, Teva, Allergan, CVS, Walgreens, and Walmart. We expect portions of those settlements to happen through 2039. However, there is no true guarantee. We've had 2 deposits in March that came in and then were rescinded because it was a mistake on the part of the settlement. We've had changes due to settlement implementation costs, so the numbers change, and the timeline of payments is constantly modified. So we're part of CareMass, which is the statewide network of municipalities that are drawing down on funds and have to report in their reporting system. So we have peer sharing calls, we do conferences, we're learning about how we do this the right way. I feel very passionately about this particular issue. The reason these funds are available is because of the malpractice that happened, and also how marketing was done, and the many lives and people we lost, and the many, many people who developed the disease of addiction because of how the products were marketed. So there are some specific areas that the settlement allows you to expend funds in. The first is prevent misuse of opioids, connections to care. Those connections to care do need to be specific to mental health and substance misuse. Harm reduction, and then treatment and recovery. Again, that is specific to substance misuse or substance use disorder, or specifically opioid use disorder. Next slide, please. So for the past 2 fiscal years, we have focused on all of the allowable uses. Allowable use 1, prevent misuse of opioids. Just a little bit for you to understand in terms of how you are allowed to use the funds. You can't supplant something, so you can't take the funding to replace a position you already have so that you could use money in another way. You have to either grow something you're already doing that meets the criteria, or you can pilot new initiatives, or you can partner on initiatives. So there's a couple areas that we have a history in, but we needed to scale those up with the addition of a small amount of funding. So our teen mental health first aid program has grown. We teach this program in grade 11. One of the components of the program is that every student that is certified learns the recovery position. So they understand what to do in case of an overdose. They also understand about Narcan. They learn how to call 911, what the Good Samaritan law is. All of these techniques are part of understanding how to respond in the unfortunate situation that they witness an overdose. We also do a lot of prevention work before we do teen mental health first aid, which is focused on opioid misuse for grades 9 and 11. We have a Rocket Leaders in Action peer leadership program. We have our mental health first aid programs for parents, adults, and older adults. Each of those components reviews the impact of substance use, how to help someone, what the resources are, how to connect someone to care. And then we also are going to be working with a storytelling company, which is a nonprofit in our state that has done work with us previously to do some prevention education for our middle schools. Next slide, please. For the allowable use on connections to care, we're doing a lot of work in this area. It's the area that we know is the most frustrating for residents that are trying to access care. Accessing care continues to be a struggle for many people, despite insurance, despite a lot of the resources that are out there. When you're in a situation where you need something, the process is not always as easy as it should be. So one of the resources that the funds, a portion of the funds pay for, is our interface referral service, which is a contracted service through William James College. There are trained counselors that answer the phone, and it's a matchmaking service for outpatient mental health care. So callers can call in, let them know what they're looking for. I'm a 16-year-old child. They seem to be dependent on marijuana. I don't know where to start, if they needed a therapist, if they need a psychiatrist. And what Interface will do is do some research, come back to them with 2 or 3 matches in the next couple of weeks with open appointments. And at times that the family has requested, they can actually do therapy. So what that means is it saves you calling 12 places that may no longer be taking patients, or don't take your insurance, or don't have availability. We've had 240 Reading families matched with outpatient services in the last 2 years. The Interface system has 10,000 providers in their system. They are all credentialed. They are licensed, no malpractice issues. Interface is aware when some practices are on vacation, when they've closed down different patient areas, what their expertise is. Do they do good with kids 5 and under in home-based care? Do they do great with kids 11 to 12 that work on anxiety issues? So that level and specificity within the mental health care system is rare. It's oftentimes people throwing you a list from the insurance company, and you have no idea what the expertise is, what they specialize in, how your family will connect. That being said, about 75% of the providers that are currently in the database since COVID only see patients through telehealth. So there is still a gap in inpatient therapeutic services and inpatient substance misuse services. So that is an area we are working on, and we do have some other referral sources. But I just want to let the board know that this is continuing to be a frustration for many people, because during COVID, many of the behavioral health practitioners gave up their offices, their leasing space, and they started these online practices. And the insurance companies don't pay a higher amount if they go back to in-person. So there is a limitation in terms of that, but we're doing the best we can to connect families to care. We hosted a providers breakfast at Reading Public Schools this year. That was trying to bring together local mental health and substance misuse providers in the area with our school staff and our school clinicians and our school nurses. We did a lot of great brainstorming and networking and connection. The more we know about the providers that are providing care in our community, and the more they know about what issues our young people are facing, as well as our adults, the better that we can work as a community. We operate the Reading Crisis Intervention Team with the Reading Police Department. That is a specialized team that is focused on intervening in crisis situations and then providing quick follow-up after an incident. We also have about 80% of our officers that are trained in the crisis intervention team program, which is a 40-hour training that focuses on de-escalation of mental health challenges and referral to services. We also engage with the Critical Incident Management System, or CIMS. It's a Middlesex County effort. We enter and track all follow-ups of any calls for service of those experiencing behavioral health incidents or overdoses if they're over 18. We entered 155 cases just in the last year from Reading. And what this allows us to do is if someone has an incident in Stoneham and they would like a follow-up because they live in Reading, we can communicate that information confidentially, HIPAA compliant, so that we can get that person multiple services if they prefer to have services in their community or beyond. So this is a very robust system that was developed by Kelly Research Associates, and we found it to be very helpful. It also gives us data on how many people actually accept follow-up care. Statistically, and this is kind of nationwide, when folks do get a crisis follow-up or a behavioral health follow-up from their community, only about 7% accept services. So there's still that challenge of people being ready to accept services. So a lot of the work that we do is trying to build rapport and engage people, meet them where they're at, but continue to offer because there may be a time when they do feel ready. We run the Pocket Talk translator program for the town. We've disseminated 35 devices to our schools, our officers, and town staff to improve communication and referral. These devices allow you to speak 80 languages. They also keep a record so that you can use it for notes. And it's much easier to use than a Google app or something on your phone because it's meant for communication, verbal communication. We just disseminate a lot of resource lists. So although a resource list isn't everything, sometimes it's a place to start with folks. And so we do have all that material available. All of our officers have packets that they can share with families. And we do follow up in the schools with those resources. Every school in the district has them, as well as Austin Prep. You can go to the next slide. The next allowable use is harm reduction. So this focuses on things that may reduce harm for someone who's actively misusing a substance, especially opioids. Most of what we see right now in terms of opioid use is fentanyl use. It can be fentanyl mixed with something else. It's often, for the most part, I would say 99% of it is counterfeit fentanyl. It's a legal synthetic fentanyl. It's not hospital grade fentanyl. So we see most of the overdose situations related to that type of fentanyl. It's very potent. We do disseminate Narcan and we do educate people on Narcan. In the last year, we had 42 adults trained in overdose prevention and they were provided with Narcan doses. We partnered on the health department with that. So we did those trainings with the public health nurse at the local library, and we found that to be a nice connection. So we hope to do that in the future when your staffing ramps back up. We also have additional Narcan doses at our station. We provide all of the doses for the school nurses. They're required by state law to have a dose in each of the buildings. So they have 2 doses in each of the school buildings, including whether it doesn't matter what age, elementaries have to have it, everyone has to have it. And part of the school law outlines that it may be an adult on campus that goes down. It could be a child. It could be an accidental exposure. So we need to have that Narcan available. Obviously, our first responders are the biggest administrators of Narcan, and they carry the IV Narcan as well as nasal, and they're really the experts in reversing overdose in our community, and have done an amazing job in saving lives. This is just to supplement, other people's access. In terms of prevention, we do a lot of work with young people around having them understand what fentanyl looks like, what counterfeit fentanyl is, what compound pills look like. What we see in terms of people getting access to fentanyl is press pills that are illegally produced. So we have drug dealers that have little pill presses in their basement and they mix things together and they make a little pill, put a stamp on it. You could look up the pill description and it would look like an authentic medication. So it's very confusing for people. When people get a little further in their use, they do know what they're getting, but sometimes they don't understand the potency or the batch is bad. Or sometimes what is stepped on, meaning what are the other impurities that are put in it, can be very dangerous. We teach the recovery position in all of our 11th grade classes, and we talk about Narcan. We educate on the Good Samaritan law, which means that if you call for help when a person is having a medical emergency related to substance misuse or alcohol poisoning, you will not get in trouble with police. They're there to focus on the medical emergency and get kids home safely. Non-fatal overdoses if they happen in Reading, are always followed up by our clinician with an offer of services and Narcan access, so we can do a quick one-on-one with folks on Narcan. Most of the follow-up that we've seen that the clinician has been able to provide has also been for families. So families who witnessed an overdose, experience post-traumatic stress or acute stress following the incident. So we've provided support around that. We also have family members of overdose poisonings where they needed support, as well as the people themselves that have gone through it. Next slide, please. The last allowable use is treatment and recovery. So because we do have a licensed alcohol and drug counselor on staff, she completes most of the referral to services. She does do LADAC evaluations, which is a diagnostic profile and level of treatment evaluation, which allows her to meet with young people or adults and determine what level of care and what diagnoses they're working with, so that you can help a family determine, okay, are we looking at a partial program? Are we looking at inpatient? Do they meet criteria for detox? Sometimes people will go privately to do that, but we do have that availability. And I think we've done 12 this year. They're very extensive evaluations. They definitely require someone with a lot of expertise, and we very much appreciate our clinicians' care with those. We run the chemical health program at our local schools. These are first, second, and third offenses. There's a school policy that says if a young person misuses substances on campus or off 365 days a year and they get caught, they can get a first offense. A first offense means they will lose a third of their competitive sports season or club. They still remain in the club or on the team, but they can't play for that period of time. In addition to that, they must meet with us for a class and a one-on-one follow-up and be assessed for referral to services. If it's a second violation, we require that they visit their primary care doctor for a full evaluation. And the reason we do that is because vaping has done so much chemical tissue damage to lungs that we prefer the primary care to make a determination on what they see, and also to make recommendations around cessation medication if that's warranted, because quitting vaping is not an easy process for kids. We can share with them all of the cognitive behavioral resources, but the addiction level is so high with the nicotine products that they really do need some assistance from the medical community. They also get guidance from our clinician for second offenses. They're required to do counseling. Third offenses require a LADAC evaluation and a recommendation for a minimum level of 6 months of treatment in whatever form the family determines is in the best interest of the child based on the diagnostic profile. We also do overdose awareness events. So you may have seen out on the comment our story Walk to Remember. This is really a representation of all of the lives that we've lost to substance misuse and suicide, including 95 of our own residents over the past 11 years. The purple flags represent lives lost to substance misuse, and the yellow flags represent lives lost to suicide. The larger heart that you see is the entire region's loss, and then the smaller heart is our Reading. We've worked with families to feature their stories, and what we've tried to focus on is educating the community on the power and potential that every person that we've lost had. They are someone's daughter, they are someone's son, they are someone's brother, father, mother. They laughed, they cried, they loved animals, they wanted more for their lives. The disease of addiction took them apart. And we really need to remind the community of that, because the stigma of addiction often puts it behind closed doors and we don't talk about it. Next slide, please. So in terms of collaboration for future implementation, we now see that we may have be expanding to get additional deposits. So we know that the fund is going to grow. We'll continue to do care sharing with the state through the Care Mass program. We meet with the 7 communities in our regional group every 2 weeks, and we have a specific group that is focused on opioid settlement sharing. So we can talk about what is Wakefield thinking of, what is Stoneham doing, is there things we can collaborate on, what contracts have you looked at, is there a better way to do this? We also have a specific group that is connected by a recovery expert on meeting with folks in the recovery community to talk about what are the strategies they're seeing work with current users, how are we looking at harm reduction, how can we support the existing efforts. We partner with the Bridge Center in Malden, which provides a whole host of recovery support services. Needs assessment, we're constantly reassessing what our needs are. We review all the local needs assessment data, and we'll continue to have interdepartmental developmental coordination, obviously within the town. We work very closely with the schools, but we'd love to continue to expand our work with the health department. In terms of monitoring efforts, there's a very specific way that we need to look at how we use the money because of the allowable uses, what the yields are for referrals and participation in programs and services, because we need to also defend the use of the funds and make sure that it is in the best interest of the reason we were awarded the funds. State support, will continue to reach out to the partners that we have and learn from our peers. Next slide. I think that might be the end. Yeah, I guess I'm done. So hopefully, I know I went fast, but hopefully that gave you a flavor of what's going on.
Excellent presentation.
Yes. Yes, excellent presentation. And
Yeah.
I'm just, I had no idea so much was being done, which is very reassuring. And it's good to hear.
I would add that doing that all with questionable funding. I mean, it seems outrageous to me that you have to go through all these hoops to get supported.
Yeah. And the piece that, I think that I've gotten some questions where people are a little confused about how you can use the funds. And one of the challenges is, especially in those first 2 years, to look at an expansion of staffing didn't seem appropriate because we didn't have a prediction of when the funds were going to come in. The dates changed. Bringing on a staff person is a long-term commitment. So that's why we have focused on programs and services specifically, because we knew that we could demonstrate how those programs impacted, but also because we felt like it was a more prudent use of the funds. When I think about every dollar we spend from the fund, I'm thinking about the people I know that we've lost from this community and the many, many people across our state that we've lost. So it's very personal to me, as well as it's my profession. And it's something that, we don't take lightly, but we're always open to suggestions and partnership. It's just a really narrow area in terms of what we can and can't do.
Yeah. Eric?
Yeah, thanks, Erica. It's always nice to see you, and I'm always impressed by the work that you do and the ways that you develop and maintain programming. Reading is very fortunate to have you and the staff that you've assembled to do this work with us. I have a couple of questions. And that comes from the perspective that the boards of health in Massachusetts have been specifically and emphatically charged with making sure that we are engaged and involved in the use of the abatement funds. And I want to figure out how we can go about doing that with you. And I don't mean this in any way in disrespect to your planning and decision and expertise. But there is that piece of engagement, and there's the question of processes and how, how are you going about getting feedback from people with lived experience, and how are you, using, how are you able to drill down from the coalition's data and focus on Reading needs and not. So I'm really interested in knowing about that. So I'm going to, and if I can roll. And then my second question is that there are a couple other areas that are more niche that are allowable costs. And I'm just curious, I'd love to know more about, how you go about choosing the areas, and what percentages of the funds are dedicated in each. I know there's the annual report, but I think sort of getting into maybe a little earlier, I'm interested in getting in a little earlier on sort of what's the thinking. Are you thinking you want it 50-50, or, this is one-time money, so we're only going to use it in this way, as you said, and not use it for staff. So that piece. And then, shoot, I hate it when I do this. Sorry, I have three
That's okay.
things. And I lost the
I can
third.
answer the first two
Yeah,
parts, and then if you think of it, just feel free to jump in.
Okay.
In terms
Yeah.
of processes, because we're engaged in a community-based assessment process annually, we are working with people with lived experience and doing key informant
Right.
interviews. What we have found is that a community meeting is not always the appropriate place for
Yes.
those conversations, and because of stigma, what we have found is working with the recovery community and talking to families who've lost loved ones is kind of the better way to approach some of that. Not that we haven't had community meetings or forums or things like that, but they have a different feeling in the sense of not everyone wants to share their ups and downs and some of the challenges they face with gaps in services. So there's that piece. And then we have, because we're part of the 7 Community Coalition, the regional group, we also are guided by kind of the same charge. What's interesting, in different communities, some are connected to their Board of Health, meaning they're under the health department. We're one of the few coalitions that is cited at a police department. But that model has worked well for us in the sense that we have stayed community focused and we try to engage all 12 sectors of our community. We have Kevin as our board liaison. So there's lots of different ways that the board can be involved, and I can communicate more frequent updates if that's needed. But I know that each community is doing it slightly different. The larger communities are getting large amounts of money. So they may be building out much larger processes to determine the use of those funds. We are considered a community that is receiving a much smaller amount of funds. So, for example, we would not hire a staff person to manage the funds because we wouldn't think that that is a good use of the funds. We want the funds to go back into the community for those allowable uses.
Right. Yeah. So, and then I guess too, I'm thinking, I mean, I know there's support for criminal justice involved. There's support
Yep.
specifically for pregnant women, and support for treatment. And they're not there, and I'm sure they're not there for very good reasons. I'm interested.
Yeah,
in
and
why.
those are really specific areas
Yes,
that need
very
to be
niche.
done extraordinarily correct, right? Working with people who really require well-trained staff and have experience with those target populations. So a couple things that we've talked about, there are some really great programs in the area. That may be something we could partner on to expand or pilot different initiatives. We have always worked with Mowers Wakefield and our regional hospitals around their pregnant and parenting, maternal substance misuse and neonatal exposure situations. They have a great partnership with Jewish Family Services that monitors the pregnancy as well as the 5 years after child is born. We recognize that there are a number of young people growing up without a parent or a parent that is still suffering with the disease. Another area that we have looked at and have put some resources in is our grandparents that are raising grandchildren. So that's an area that we would like to continue to do more with and find out what specific supports might be the most helpful. And then another area is something for children that are grieving. So there is something called the Comfort Zone Camp for young people that have lost a parent due to substance misuse or suicide, where they can meet with other young people their age and get a safe camp experience to learn how to process grief. So there's a lot of different pieces that we could pilot and or provide scholarships for people to attend different programs. One of the tricky areas I will say that we have to be very conscious of is the treatment industry for substance misuse there are for-profit entities and there are nonprofit entities. Some are licensed, some are not licensed. So we're not just going to go, oh, you sound like you're doing a great job, let me throw you 6 scholarships. We're going to do our due diligence to determine who is licensed by the state, who has had no issues, what do clients think of the program, does this an appropriate use? So one of the areas that we are looking to do scholarships for is for the Bridge program in Malden, because they do job assistance for folks that are coming out of the criminal justice system who are also dealing with the addiction. So that type of program where we've seen success over the last 3 years with clients that have already been referred, that might be something we would look at. But these are costly programs. So again, with our money, things may only go so far. So we'll weigh those pros and cons. And that is also an area where we can invite community input. It's just a matter of trying to prioritize what we have been able to do and then look at how we can pilot and expand. there's always more to learn with this disease and this issue. You know, I've worked in the field for 26 years, and I never take it for granted that there's always something to learn. So I'm willing to talk to anybody. But I do also wear the hat of discretion, because there are a lot of promises made, and there's a lot of vulnerable people that want to get better that have been sold a bill of goods. So we're not going to be sending money to Palm Beach for the $50,000 a month rehab that isn't really licensed or doing a great job. You know, that type of thing wouldn't be appropriate. So I don't want to sound cynical, but we've seen a lot of families in Reading, unfortunately, remortgage their houses and place a lot of money into the hands of people that we really can't trust. So I want to make sure that we honor what we've learned, and then also make sure we're working with reputable partners.
Right. Okay. So I'm curious, and I know you said, if that's requested or required, I'm requesting it, and I think it's up to the board for how we do it. But maybe now that we're 5, I can join Kevin in working with y'all, because I am interested in knowing more about the decision-making processes and the designations, and I want to be able to be supportive if I can. So thank you again for all the work that you do. It is a lot, and we are really, really fortunate to have you. So,
Carrie, I appreciate that you brought that up, because the timing of the meetings, I have not been able to make the last few of them. So if you want to run with that baton, by all means, you can do so. I apologize, Erica, that I have not been.
No, that's okay.
It's been, from a coaching standpoint, it's been a difficult time period. So
I could send the information, and we can see who can come, and we're very happy to have anyone who's interested.
That's great. Thank you. And because Erica, now we are actually a body of 5, so there can be more than
that's great.
us in one place at the same time.
I love that.
So,
Erica, can I ask you a question, or maybe I
Sure.
should ask you, Day, or both? You've done all this great work with the Mystic Valley Public Health Coalition, but now we're also part of this other collaborative.
Yeah.
Have you and Day talked about how some of the work might be expanded, potentially with additional resources from this other collaborative, in terms of the work you're doing? I'm not sure where the overlaps are.
I know that there's overlap amongst the regional coordinators. So I know that our regional coordinator does meet with all of the groups in the state. And so there's collaboration there. There's a shared services grant, in our region, as well as that Reading is part of. We've been part of the Mystic Valley Public Health Coalition for the last 10 years. And Reading was a member at one point, but then decided to go in the other direction, to go with Andover. So it's doing a lot of the same works. It's just, kind of a different combination of communities, but we're always open to learning more. And we do participate in a state conference and other things where we share ideas and things like that. But if there's anything that Day wants to keep me up on in terms of what that group is doing, and Day is always welcome at our regional coalition meetings.
Day, I don't get a sense that
in terms of the group that we're in, there's no mental health component in that. So I don't see a way for us to overlap.
Right.
I would also say that the Andover Collaborative is still in its early stages and still hiring up and organizing its thoughts and goals about where it's going. Hopefully over the next few years, frankly, those towns could use probably some substance abuse and mental health work.
Yeah. And I know many of those towns have things going, individual coalitions as well. It just might not be coming through that shared services project, because I know different communities have focused on different shared services. I know for us with the Mystic Valley, we have had a grant for the last 10 years through the state that was very specifically focused on substance use disorder, but then they also have a shared services grant that's focused on health communication, inspection, and all the other kind of good stuff. So they're kind of doing both, but every community is set up a little bit differently. But we do find enormous value in having those 6 community partners, because if we haven't tried it, they've tried it, and vice versa, and especially around this funding, we're all trying to make the best choices we can and learning from each other. And there may be something where we say, yep, let's go in 3 communities and try something. We do have to follow all the state procurement laws, all the contracting information, all of that good stuff. Our previous use of the funds were approved by the town manager as well as by town meeting. So just so you understand, it's as transparent can be, but we're always happy to answer specific questions.
Any other thoughts or comments for Erica before we let her go? Great. Thank you so much for coming. Really appreciate it.
Sure. Have a great night. Thank you.
Thanks, Erica, for all you
Thank
do.
you.
Bye-bye. Very encouraging.
Yes.
So moving on. Albert, Les, are you there? Thank you for being patient. I hope. There we go.
Good,
Hi.
good evening. Can you hear me okay?
Yes, yes. Thank you for wading through an hours of agenda.
Hey, learned a lot. Still learning, so I'm glad to be invited.
Absolutely. Carrie had suggested having you come, and I thought it was a great idea. We have, we're in the process of developing the community health improvement plan.
Yep.
And we have, I think you've been involved in that, and you've seen, we have 3 goals, and the whole issue of diversity, inclusion, equity has sort of underlined all 3 goals. And so it sort of made sense to have you come and talk to us about the work you're doing in Reading around this area, so that we can understand how it fits with those improvement plans.
Yeah, that sounds great. And I agree. I mean, I think there's a lot of alignment there. And so, yeah, I'm happy to talk about the work. I do have a little PowerPoint, but again, I can walk through some slides, but how much time do I have?
20 minutes.
Let's go for
15,
it.
20
Okay.
minutes.
Can I share my slides or do I need
Yes.
to?
Yeah, you
Perfect.
can. Is
Okay.
that-
So, let me, right, give me a moment. So when I do this, I'm not gonna be able to see your amazing faces, and so that you need to at all signal. I have to come off mic, okay?
Okay.
Okay, cool. Okay. So I think the biggest thing, again, it's all about me, right? So I just want to make sure that you guys know that slide. So I'm just going to give this. Folks may know little, folks may know more about the Office of Equity and Social Justice here in Reading. So I'm just going to capture some basic things, and then we'll talk a little bit about the assessment that we just did. And then I want to definitely leave some time for Q&A. So, just to start with me, again, I'm a public health guy. So, I think for me, I'm loving being around you guys, because this is what I did for 25 years. And so, and also I did a lot of community organizing. So for me, community engagement, those things, reaching hard to reach populations or engaging them is that gets me excited, right? In terms of engaging them in any process. And so I'm excited about doing some work with, this community health improvement plan in terms of engaging certain communities. So that's kind of me. Again, I won't read through all of this text. Some of it's dense. I just kind of pulled together some slides that are already existing, but I essentially want to kind of share with you our mission. And the mission is, it's a town-wide service, right? With, providing education, a lot of education, support, resources, with the end goal of trying to make Reading the most inclusive community it can be for all of us. So there are some things, and I'll share with you things a little later around how we're going about doing that, but that's what our mission is. We are revisiting some of our work. And so again, I'll speak to just 1 minute later but that's kind of, pretty much going to stay true to that mission. Our approach is pretty simple. We're identified as like the point, for information and really providing best practices and resources. So that's what we're trying to carve that niche out on the town side as being that kind of point resource. Again, we're still trying to, we sit in the library. We're still trying to figure out where we sit at, what's the best place. My position sit in very different places across the state. And we're still thinking strategically about the best place for me to sit. This work's not about enforcing, but it's about encouraging, being aware, making aware education, particularly around DEI principles. A lot of our work is supporting other departments. So when our work is like, I'm like a consultant, right? I'm helping other departments, boards, everything like that. How can they build their capacity for DEI, right? So that's kind of my function, right? I'm not going to obviously be the doer. I'm hopefully to get folks to adopt the practices for themselves. Also, we're a community resource, helping to, again, have difficult conversations, and encouraging, again, dialogue across these various different issues that we're dealing with. So that's kind of our community arm or role around that. Everything we do is based upon data. That's kind of what I've adopted. That's how I operate. So for me to come into an assessment process was gold for me, because we have a great set of data that we can use. And I'll talk about some of our findings later. I'm sorry, our recommendations from our consultants, 5 of them. I think we also, want to be, a collaborative approach. Everything we do is in collaboration with others. So I'm excited, even as we did this assessment, that we did this in collaboration with a bunch of community partners, community residents, our town municipal staff. Like everything we did was done with that, because essentially this is not owned by the office, it's owned by the community, it's owned by the municipal. So the work is. So that's why I want to make sure I'm pushing that ownership. You don't look to the DEI guy to do it. It's not about me. It's really about all of us, and really build that capacity for others to do it. Also, our practice is to be open for feedback, and really how do we continue to build this work, right? Just because our work would be, we're going to set forth a set of work for this year doesn't mean that won't change and be adopted, and adopt different practices moving forward. We have this kind of disposition in Reading, and it's not the same in all municipalities, that it's an inward and outward facing position. So we do some community work. Again, I've adopted some of these practices, events, but essentially, the main ones that jump out are MLK, which we did in January, Juneteenth coming up in June. There's also some other events that, again, have been on the menu, that, Pride event, some other ones that we just kind of, again, have adopted, a presence there. And a lot of the community arm of this is really to again, build capacity for the community to do this work, but also to celebrate and recognize the various different cultures in Reading. So pulling out that diversity, so it can be clear that there is, different aspects of diversity, that's racial and ethnic diversity, gender, sexual orientation, you name it, right? So that's intentionally doing that. Again, I mentioned this whole idea of doing things in partnership. Really it's about building relationships. And we have a particular arm of our work called PAIR, which I'll speak to in a moment, Partners and Allies for an Inclusive Reading. Again, a project I adopted, inherited coming into Reading. And I think that's just a way for us to have that bridge built between the community and our work. So these are kind of, again, the way that we look at relationship building. Again, we have our town departments, and I didn't list them all, but those are some of the key ones that we're kind of aligned with, right? You know, these are in the middle, some kind of community networks and organizations that our work is aligned with as well. And then you see the boards, which you guys are on there as public boards, that we see our work again aligned with. So this is where I think we think about kind of who we are initially strategically working with. This is who it is, right? This is kind of our starting, our starting place. And again, I would say a lot of this work is being revisited with our process that we're going through right now. So, and again, I'll speak to in a moment, but again, this is really where I think we're trying to be a lot more strategic about who do we align ourselves with as we think about the long-term work. Again, just really thinking about networking, a lot of our work is kind of that same way. We're thinking about how do we network with other municipalities, how do we connect with, happening around the regional work, and even think about statewide. There's a DEI coalition that exists that I belong to, which is about 40, 50 of us who sit in places just like who really, creating best practices, sharing resources, sharing ideas, everything from like, hey, what's your budget? Hey, how do you engage your planning department, your board of health? We're all kind of sharing those ideas so we can create, again, some best practices to do our work. This work, essentially, municipalities is about 3 or 4 years old, so we're still all figuring it out, right? Municipalities are trying to still figure out, like, where do we place us? How do we pay us? What do we pay us? Where all those things. So again, that network is helping all of us do that. Again, this is that payer organization. It's really kind of building allies who are out there in the community doing this work. And so we're now engaging these next 3 months. So June, July, and August are going to be really strategic months that we're going to be really focusing on revisiting that model. So we have a consultant coming in that's going to really kind of step in and do some strategic work with that group. And so we kind of relaunch PAIR probably in September. But right now, again, we're still kind of operating off the model of kind of bringing folks together. We're doing a community engagement workshop next week to really, again, build some skills and tools that our community members can have to go about engaging others. So this is something I want to share with anybody. Anyone's welcome to go, not just PAIR participants, to really learn about effective ways to do community engagement. Again, this is our structure of PAIR right now, but that can change. That's probably going to change. We had these 3 buckets: education, partners and resources, and community engagement. So I want to jump to our assessment, right? So we did this assessment. I'll share the timeline in a moment. This assessment was pretty much, I think, again, gold for us in our work. And excuse me one moment. So. Apologies. So again, this assessment is something I came into it October when it came on. It was really started probably by August to really do a deeper dive around what the community and what the workforce, kind of building where their knowledge base was around DEI practices, and really begin to kind of take that data, and that's what we're kind of trying to do now. Take that data and begin to be strategic about how we go about implementing some of the findings that we got from that. And again, we have a report that just dropped about a week ago, which I'm willing to share. It's widely, it's out there, as well as we have a slideshow presentation that was put together by our consultants. I can share that as well, which gives you a lot more information that I'm sharing here in this. But again, we had a consultant come in, really excited about their work with us. They just ended their work with us last week, actually. So this essentially is kind of the roadmap that they kind of took us on. So again, this was a process of looking at, again, a ton of data from Reading, dating back to probably 2010, and really kind of taking that approach with grabbing that data, doing that kind of background research, doing the community engagement work around kind of working through focus groups and some other one-on-one interviews to really begin to gather data in different types of data, right? So we can begin to kind of move forth in an inclusive way. We did a root cause analysis exercise with our community around kind of going to do a deeper dive to make sure that we understand kind of the whys, they call them, whys, not just taking the surface data, but really going deeper in terms of, why some of these things existed. 5 recommendations that came about from this work. One was this idea that we really need to diversify our boards and committees. Again, this was really tend to look at racial diversity. And so it's something that I think we're going to try to think about how to prioritize some of these findings, but that was one of our findings, again, how to diversify boards and committees. Another finding was really how to diversify our vendor supply, and kind of who we work with as vendors, to diversify that kind of pipeline, that program work. And another recommendation was to build a townwide kind of pipeline to get more effective diversity of candidates in that pipeline. Again, this is something that's kind of directly connected with our HR department, but also just taking a step back and having every department and board on board around how do we go about, again, diversifying that pipeline. And the other, finding again is recommendations was us to kind of do a deeper dive, into the state of the workforce and learn about the challenges about recruitment. Also not about recruitment, but also retention, and to really create this welcome and inclusive environment, in Reading. And our final recommendation was to enhance the role of community-based organizations and town events and communications. So again, I could share the full slide deck with you, which has a little bit more detail and the report, but in terms of what happens next, and I'll come off slideshow in a moment. Right now, I think the goal of this is really to move towards having a strategic plan. Typically, when you do these assessments, you have a strategic plan. We're working on trying to develop that right now. It wasn't a part of the initial assessment, and so we're really working towards pulling together that strategic plan to think about implementation going forward. So what that means right now, again, I just tried to fast talk a little bit to save you some time for questions, is that we have a team on the municipal side. We call it our implementation team. There's made up of about 6 or 7 individuals on the workforce side, including our HR department and others, that are really thinking strategically, how do we now engage our workforce, right? How do we go about beginning to build some of these practices on our workforce side? And again, this is just the workforce side. We're going to probably use our community group, pair, and other groups that we may have to develop to really do the more engaging on the community side. So I'll pause, see if anyone has any questions. Again, I think I try to stay in my 15, 17-minute window, but if anyone has any questions.
It would be, not a question, but it would be useful if you could perhaps email that report to Aday and he could distribute it to the board. I'd like to see the detail as well.
Of course. Day, I think you have that. I think Matt sent it out to everybody, so all your department heads. So you probably have that. I think he sent it last week. So check that. If not, I can send it to you. So it's both the report, which is
if you have it, you can forward it.
Yeah, of course.
Yeah.
45 pages of fun reading. Do that at night. But no, I think it really gives you a really deep dive. And I think you'll appreciate the methodology that our consultant used to go about getting this work. So yeah, definitely that'll come to you guys.
Great.
And any other questions? I'm available after the meeting or another time if anyone has any other questions, but we're kind of just getting started with our work.
Harry?
I don't have a question, but I just wanted to say thank you. Thank you, Rick, and thank you, Aday, for and entertaining my request. And I think as I said when we talked about it initially, it's important because health equity is a part of the work of public health. And you know, if
Yes.
assessments happening in town, you know, there's always assessments, right? It's trying to keep track of who's assessing what and how do we make sure, as you said, Rick, how do we make sure that things are kind of aligned and parallel or not? So I think it's a great opportunity to get to have folks meet you, Albert, and to hear a little bit about that work. I am a member of PAIR, and I do attend. I think Aday assigned me as the liaison a while back. I'm sorry, I didn't mean to make you giggle when you were taking a
You're
sip.
putting me on the spot.
Right.
that-
I willingly went, but I am a member of PAIR, so I have attended some meetings, and Suggestion did a nice job, and I think Albert is doing a great job picking up now on that. And Sudeshna was the first, and Albert has the benefit now of getting to build on that and take the work that he did in Andover and teach us about that as well. So
and just a quick to that again, and thanks, Carrie, for that. Carrie and I know each other for years, so we're like old friends. When I left Andover, they were just doing their community needs assessment. They were doing it with Andover, North Andover. So again, got pulled into that process. I did a ton of community needs assessments when I was in Cambridge. And I'm appreciative of first when Andover pulled DEI into the space. I'm appreciative here where Aday pulled me into the space, because I think not just because we're talking about, same data or, similar things. I just think really being able to pull me in strategically. So we're thinking as we begin to implement the work is that we're doing that together. It's not like separate, what I'm saying? We're being thoughtful about how we use together, because we're thinking about the community, right? And we want to make sure that we're doing this in a thoughtful way. So I appreciate they pulling me in. And again, I think there's a lot of alignment going forward. So let's continue to think like this. And I think as we begin to get more clear about our strategic plan, I would love to come back to this board and share with you that strategic plan. Because as you saw, Board of Health is on definitely one of our lists around a board that we want to be thoughtful around. And I would encourage you, even as a board, and I would love to come back and talk with you about, even as you think about diversity within your board, because again, it was called out, we didn't call it out, it got called out around the boards and committees not being racially and ethnically diverse. And so really, I think you should think about really where you could diversify your own selves, what that looks like for you. So willing to work with you around that too.
Terrific.
interesting. So Albert and I worked together back when I was first starting my career. Well, we worked adjacent, right? Side by side. We didn't actually work together, but we both worked in the same health department.
I was 12, so I was only young.
Right.
So I was one of the
Right.
youngest.
And
Yeah.
I was like 10. Yeah. But but yeah, and I was pleasantly surprised when I saw the flyer announcing that he had been selected to join Reading, and it was a great chance to get to go see a familiar face and reconnect. And so yeah, he's a good man from my own personal and professional experience. And yeah.
We look
Thanks,
forward to seeing
Albert.
you many times more.
Most definitely. Love to invite back. So yeah, I know that you guys are at the rest of your meeting, so I'm around. Resource, email me, reach out. Thanks Aday. Talk
Thanks,
to you.
Albert.
Bye,
Kevin
guys.
has a-
Albert.
Bye, guys.
Albert.
Hey.
Oh,
Oh,
sorry. Kevin
Sorry,
had a
one sec,
question.
Albert.
I'm here. Yeah. Hi.
Sorry.
I just got a couple quick questions. First,
Yeah.
I heard you said, you're looking to see where you want to be parked and where's the best spot for that. So, it's interestingly enough, do you know the full research on your position? Because
Oh yeah.
when it was originally proposed, the school was the alternate parking spot for that.
Yep.
So
And
I've often felt like, the work you're looking to do, in my opinion, is really generational, right? It's not something that happens tomorrow, a year from now. It's 10, 20, 30, that you have to be thinking in that long game, right? And that's where, I think originally everyone said, for that reason, the schools is a great spot to park the position. So
Yeah.
I just, as you're moving forward and thinking about where you're going, I would encourage that line of thinking, because I think it's a I think going at working with the youth more than anything is thinking about long term, right? That's where it all begins. Just my own little 2 cents.
And I love it, Kevin. And I'll my response to that again. I'm on record for this, so you know. So just because I know town meeting, select board meetings are on tape. I went on record to say that. So I'm a believer that you need both, right? So the model I believe works is that the schools need their DEI director and the town needs theirs. And the models, that is the model going forward. Arlington has it, Lexington has it, Andover's about to have it. That's the way it needs to go. There's different cultures that exist. But I believe with you with the generational piece though, and I love that. I just think on the town side, the ability to work with policies and systems, I think is the way to go. That's where I feel like you can go deal with the root cause stuff. So again, that's just, from my experience, but I hear you, the schools need theirs. And I think Tom is really working on that.
Great.
Yeah. Sorry, I've got to hop in again. Just it's such a good question. I was curious if anybody was going to pick up on it, Albert, when you did raise that point of where does this thing sit? And I've thought about it. I've heard a lot of different discussions about it, and while I agree that there's certainly the seeds you're planting, you want to make sure you're planting seeds with the people that are growing up. But I think there's an access issue that, I thought about. So I had some questions about things when my child was younger than school age, and there was no way of me accessing the school, right? It becomes sort of a captive resource to the school was what I was a little concerned about. And I also thought about workforce questions. And as we think about the things of, if a community is interested in diversifying their workforce, there needs to be somebody who has that as their responsibility in the town, and that would not be met by somebody in the school system. So it's a complicated question, and boy, there a lot of passion and conversation in town about it. So thank you for stepping into the
this is. It's a challenge again. Yeah. I sit in very different places across the state. Some of us sit, in fact, in health and human services. Some people we sit all over, right? We're trying to create a best practice around where we believe these positions ultimately, we create a guide for this. We believe they ultimately need to report to the town manager. That's the ultimate reporting structure, because that's how important we feel like this work is. And there's some models there like that too. So again, we'd love to come back. We'd love to share with you as we progress. Some really important meetings happen over the next couple of months. So I may look very different in summertime when I come back in terms of where I'm at. So we'd love to connect with you guys. So again, thanks for inviting me. You're like my second family. So please invite me back. And next time, please feed me, because I feel like that's how you. All right. Take care, guys.
Good night. Thank you.
Good night. Thank you.
All right, guys. Bye.
All right. So Aday, you're on.
How many minutes do we have left?
You have as long as you need.
Just kidding.
11:59, I believe is the technical term.
All right.
Each town meeting went to 11:30 last night and 11:55 Monday night. So
wow.
Sorry, Nick.
Brave souls to be on in that meeting, I'll tell you.
All right, so the month of April was a productive month. We conducted 13 food inspections, 3 food re-inspections, 1 temporary food inspection, 4 housing inspections, we issued 1 housing order letter. As you all know, Jen is leaving. Her last day is May 16th. It's I'm not too happy. Go ahead.
I know you can't get into specifics, and I'm not looking for that, but hypothetically, if there was an increase in that position, salary-wise, would that be an easier position to fill?
Absolutely.
Okay.
That's a rhetorical question.
Okay.
Yeah,
Too bad
Hiring
we just
is
had
tough
town
out
meeting.
here right
Harry,
now.
too bad we just had town meeting.
We missed it.
Missed it. Okay. See you in November.
yeah, it's sad because you know, Jen has been very instrumental to the success of our department. But you know, it's sad to see her leave.
It is. She was great. She was a great employee, great person.
Yeah.
Is
Really,
is
yeah.
is a great person. Excuse me.
I mean, we kind of talked about things, and she is willing to you know, continue doing inspections, you know, on a part-time basis. So we are looking at that option. I'm gonna have to talk to HR regarding that. But she is willing to come in and help us out till we can fill the position.
Hmm.
So that will be an avenue to explore.
All right.
In terms of and also we have the shared services inspector and the shared services nurse that can step in as well. So I'm pretty confident that we will still be able to meet you know, daily demands. But again, we need to get somebody in here as soon as possible. So in terms of disease surveillance, from April 11th to May 9th, we got one confirmed case of tuberculosis, 9 confirmed cases of influenza, 8 confirmed cases of coronavirus, 1 confirmed case of group A streptococcus, and 2 confirmed cases of norovirus. And I say this at the end of every meeting, you know, we urge our residents to continue taking precautions and get vaccinated if they haven't. You know, simple things like, you know, washing your hands regularly, cover your coughs and sneezes, you know, wear a mask if needed, stay home when sick, and, you know, keep your distance if you're around someone who is sick. All those little precautions do help out. So let's see. In terms of the public hearings, we have the community health improvement planning process hearing. That would be at the select board meeting room, 7 p.m. on Monday, May 20. So you know, we urge the residents to participate. I mean, we haven't really gotten like a lot of traffic regarding this. I've not really seen so many emails regarding this, but I'm positive that you know, people are still interested in it. In the next couple of weeks, we'll do a better job of advertising it. We have it scheduled to go out on Monday on our social media platform. So we'll see what the turnout is going to be. And then on the 23rd, we have the public hearing for the amendments to the Board of Health regulation restricting the sale of tobacco products. That would also take place at the Select Board meeting room at 7 p.m. on May 23rd. I mean, I think this is going to be huge. We have different people talking about it. We have a lot of emails in support of it. And, you know, we have emails opposing it. I would say like 90% of the emails opposing it are from the tobacco retailers themselves, the business owners. Yeah, but I believe the select board would attend this hearing as well. So yeah, it's gonna be a big one. Let's get ready.
I've already been called a communist because of this.
Absolutely.
Have you?
Too many names. It's unbelievable.
Wow.
Yeah. And Dr. Lopez, in terms of the hearing, you don't think you're going to be available. Is that correct?
On the 23rd?
23rd.
Yeah, yes, I've been talking to Aday and Carrie have this sort of very difficult conflict that we're doing work on our home on the vineyard, and it's going very slowly, and we have to meet with contractors, and the problem is the ferry. The ferry is just solidly booked, and trying to move that around has been difficult. I'm on a wait list, but we'll have to see how it plays out. But I have every confidence in Carrie chairing that meeting, if that's what it comes down to.
We'll do you proud, Rick.
Yep.
All right, man, there's nothing else.
Yeah.
On my side.
Sorry for the loss of Jen Aday. I know that
Yeah, it's hard.
It's hard.
hit very hard. She's very talented and
Yeah.
great to work with. So
Yeah.
sorry. I know hiring is tough right now too. I'm in my own seat. I'm filling 4 positions, so I feel your pain. It's a very competitive environment out here for public health.
It is.
professionals. It is very competitive. There are jobs everywhere.
Mhm.
So high demand, and to your point, Kevin, not necessarily compensation in line. I don't know specifically about where Reading stands in it. I'm just speaking generally, but so
Yeah, neither do I, but I know typically, and this is a simple belief, you throw money at the problem goes away. That's typically how I've come across things in life.
oh my gosh.
It's a very simple, like I said, it's a very simpleton way of looking at it, yet it's 100% across the board every time.
Oh, maybe not everything.
Not every time, when it comes to jobs.
Okay. Yes.
When it comes to employment, whenever I hear we're having a hard time filling it, first thing I think of is, geez, you're not paying them enough.
Right.
Usually that's simple,
Yeah.
but life is not simple, and we don't have unlimited funds. And then if you start throwing money around like that, everyone else starts looking, wait a minute, my position's a little underfunded too. So I get the whole scheme of it all, but yeah. Now, I think we just actually, the town, didn't we just go through a round of bringing ourselves more into the kind of the middle of a pack? We were kind of low on, I think, on what we were paying. Call us from town meeting, Carrie. Didn't there a presentation on that?
That was actually the school's budget presentation, or actually, sorry, it was school committee chair Tom Wise talking about the contract negotiations with the school.
Right.
Yeah.
So I think we've undergone it for the town as well too, and I think they have
Yes, there was a paying class study
Yeah.
conducted last year.
Okay. Okay.
Everybody got a little something more, but it's just not competitive enough, I guess.
Right.
So it's going to be me and Cassidy.
Cassidy is a rock star too. So
Absolutely.
Yes, she
You better
is.
not leave me, Cassidy.
they're like the
Try.
they're the 3 musketeers in there. So it's a shame to see the band breaking up, but I know you'll find somebody.
Yeah, don't make them cry.
God. Don't make them mad.
All right. Any other final comments before we adjourn?
Nope.
No? Okay, make a motion to adjourn. Do we have a second?
Second,
Second,
Okay, Kevin. Roll call. Joan,
yes.
Kevin,
yes.
Paula,
Yes.
and Carrie,
Yes.
and Rick. Yes.
Go
All right,
Celtics.
we'll see you at the hearings.
Yep.
See you at the
See you there.
hearings.
Good night, everybody.
Bye-bye.
Thank
Good
you.
night.
Good night.
Recording stopped.